Welcome to the very first episode of the HTS Labs Podcast, where we dive into the world of medical diagnostics and explore the innovations shaping the future of pathology. I'm Anya O'Donnell, your host, and I'm thrilled to have you join us on this journey. At HTS Labs, we're passionate about transforming pathology services through technology, collaboration, and an unwavering commitment to quality. In this series, we'll be talking to experts, sharing insights into our proprietary systems, and discussing how our approach impacts both healthcare providers and patient outcomes. Today, I'm excited to introduce our special guest, Patrick Clarke, the CEO and visionary behind HTS Labs. We'll hear about the origins of HTS Labs, the inspiration for starting a pathology services company during a particularly challenging time, and how the company has evolved since its inception in 2020. We'll also explore how HTS Labs leverages advanced IT systems to improve diagnostics and the role of our unique partnership model in delivering high-quality, reliable services. Plus, Patrick will share his thoughts on the future of pathology and what excites him most about the opportunities ahead. So let's get started. Patrick, thank you for being here today and for sharing your story with us.
No problem.
What was the original vision for HTS Labs and how was that vision evolved since the company's first inception in 2020?
Yeah, okay. I think the original vision was to look at some of the subsections in pathology that we felt were under catered for in terms of the service arena in Ireland. And whilst medical pathology has been referred out of hospitals, public and private, across the island of Ireland for many years, there's certain areas within it that maybe didn't have as robust a referral system as other areas. And so, in particular, histopathology was one area that we saw as being a difficult area for hospitals and laboratories in Ireland to gain access to support if they needed it. So really the vision at that point was to say, let's become an outsourced support mechanism for private histopathology in Ireland. We do obviously run other tests like genetics, in particular the non-invasive prenatal tests. But predominantly we were looking at histopathology and saying, well, blood sciences are well catered for actually in Ireland because there's a number of private laboratories already set up with, large throughput systems in place for your standard tests, your U&Es and your LFTs and your FBCs, etc. But histopathology particularly wasn't, and histopathology is it's quite different to the other sciences insofar as that you've got a huge amount of technical work on the front end, and then you've got a huge amount of professional work at the back end where a consultant has to sit and read slides and make a diagnosis, etc. That's unusual. That doesn't happen in the other sciences, and so there's quite a lot of work in there, and it's quite labour intensive, it's quite expensive, and it's quite specialised. And we felt that we were able to cater for that because we had a very good working relationship and connection with some other what I would call gold standard laboratories around the UK and Europe, etc. And so we formed those alliances. We put together a front end system through Jihad's building of the front end portal, that system that makes it very easy for clients to input their data, their patients' demographics into the system, and tracks all the way right through that system. It's a really brilliant piece of software that was built in house, and so the vision was to make the front end really, really brilliant for people, make the service really, really good for people, get results back to our clients on behalf of their patients in a quick and robust way without affecting the client so greatly, to make it really easy. And I think we managed to achieve that, and I think we managed to achieve that early on, and so a lot of the clients, particularly in the early stages, our customers had really enjoyed the easy accessibility of what we were putting forward, and delivering a great set of results for a reasonable cost, reasonable price. And so that was the vision, was to be the best provider or service provider for outsourced histopathology in the country. I mean, that was the vision, and we've stuck pretty rigidly to that actually over the last four years plus, and it seems to be a successful formula actually, and seems to be working quite well.
You've developed proprietary IT systems like TrackR, TrackS, TrackP and TrackF. How did technology become a cornerstone of your strategy, and what impact has it had on the industry?
There's loads of labs in the world, public and private, and they can all perform analysis and generate a set of results, and they all do that to a certain standard. I mean, most laboratories now are ISO accredited, ISO 15189 or 17025 or whatever the standard needs to be for their lab, right? So the actual operations of being a laboratory has been in play for decades, many years. But as a service provider, as a private service provider, the key isn't necessarily the getting a test or a result. The key to it is the front end and the back end. That's where your issues are going to be. It's going to be pre-analytically at the front end, or it's getting your results out at the back end and getting those out in a timely fashion within a turnaround time that actually works for the client and or your customer and actually their patients, right? And the only way really to do that is to have cutting edge technology integrations with your partners to allow them to be able to book in a referral on the front end in an easy and concise way, then track that sample all the way through the system, and then get a result back electronically in a very concise way. Traditionally, certainly from an Irish perspective, this idea of full IT integrations has only really come to bear in the last 10 to 15 years. And it can be quite difficult sometimes for large hospitals and large hospital groups with laboratories to be able to dedicate resources and time into forming these IT integrations. So we said, well, we need to be able to offset that for our customers. We need to be able to make that easier for our customers so that they don't have to spend a great deal of money, and probably more importantly, a great deal of time and resources in trying to get these integrations up and running, just so that they can have a smoother, better service. And so when we built out the IT system, the idea was that we'd make it so user-friendly, so easy and accessible for everybody, that it took away that barrier to entry for a laboratory to use our referral services. And so, to be fair, I think that's where our skill sets really pay dividends. If you were going to try and do or build the system that we've built without having any knowledge of the industry, I think you'd really struggle. And that was kind of key, I think, was working with these LIMS, with what we call laboratory information systems or hospital information systems or even patient management systems. Working with a whole load of those over the last 15 years or more gives you an in-depth understanding of not so much how well they work, but probably how you don't want them to work, right? And so you can eliminate those problems and you can create something then that works a lot better. And so with Jihad and his background in particularly in medical IT and systems, he had a great understanding, a real in-depth understanding. Add into the mix then somebody like Steve and myself who would see systems from another end, which is how a customer actually wants the system to perform. And I think that really gave a really good in-depth understanding of what will work. And so we built it that way, and we built it so that it's accessible to large public hospitals, it's accessible to small private clinics, and there's a method or a way for each one of those to be integrated with us. And it takes another major pain point out of the way. So that's what we've worked really hard on doing. And I think if you're going to ever get into private pathology or a referral type business, if you don't have IT and an IT system as your cornerstone, then it's just not going to work for you.
HTS Labs doesn't own a laboratory, but partners with a network of accredited labs. What led you to choose this model, and how does it benefit both your company and your clients?
It's an odd one on you, because I think customers, it's a new concept, relatively new concept, or it seems like a new concept, but it's actually not a new concept. Any of the private pathology providers, not just in Ireland, but globally, cannot run all the tests that they offer. They just simply wouldn't be able to run every single test. They have to have partner labs that are able to run some of the tests, because a certain lab might be a reference site or a reference laboratory for certain tests, etc. And if you don't have the volume of samples coming through your laboratory, then you simply just it wouldn't be cost effective to set that test up. So there's very few, certainly don't know of any laboratories in the world that run all of the tests they have on site. Then make that even smaller and bring that down to an Irish perspective. Ireland's a small country, as we know, and having a laboratory on the scale of some of the labs that we're able to utilise across the globe just doesn't make any sense. It just doesn't make any financial sense, resourcing sense. It just couldn't happen. So labs have always referred tests out, and particularly any of the more esoteric or more unique tests that are out there that they wouldn't run in their own laboratory. They would have referred them out, right? And that's all we're doing. Effectively, we're choosing the best partners that we can find globally with a specific skill set, with a large enough business, with a large enough laboratory, with large enough resources to be able to handle the types of workflows that we refer out. And one of the big issues actually with pathology is this idea that our customers don't need our services all of the time. Particularly in histopathology, there's going to be times where customers have periods where they're short on staff, whether staff are out sick, whether they've had retirements they're trying to replace. They've got some of the particularly in the public system, there's resource issues anyway, trying to find staff, and there can be constraints around resources and hiring resources, etc. And so when in those times when laboratories are short on resources, sometimes backlogs can happen, because the workload never stops. In fact, the workload, it grows, it increases year on year, because our health service puts more services in place, new clinics, new surgical theatres, etc. And that generates more samples. But the laboratory still face the same resource issues, etc. So there's certain times, there's nick points at times, that labs need support and help. They mightn't always need it, but they might need it for a month, they might need it for 6 months, they might need it for a year, whatever it might be. And so we're able to take large volumes of backlogs and get those samples analysed with our network of laboratories, because the labs that we're using are specialists in histology. They're the best that we have in either the UK or in Europe, or in the world indeed, but particularly UK and Europe. And we're able to get that work done without putting huge pressures on these much larger labs. In other words, we're able to load balance. So if one of our customers asked to refer out quite a high number of samples to us, it doesn't put any pressure on our network, because we've got such a large network, and those networks of labs that we work with are very large specialist labs, so they're able to handle it. So therefore, when peaks and troughs come into the system for our customers, or particularly at times when there's peaks, we're able to take that workload as a referral piece, and pass that through our network of labs without there being any resource issue on our side. So we've no rate limiting factors. And our customers want to get their results back. They want to get their patients' specimens through us. They want to get their results back in a timely fashion. That's it. They want to make sure that it's done in a safe way within a safe lab network, and that's where we utilise the very best labs we can with all of the accreditation statuses that are required, such as ISO 15189, etc. So yes, we don't actually physically own a lab, but that's a huge benefit to us, because it means we've no rate limiting factors, and we can utilise the specialists in their fields to do the job that they are trained to do. And so that's why we don't own a lab at the moment.
You recently established a Pathology and Quality Governance Board. What role does this board play in steering the company towards excellence?
Yeah, well, I think it's no longer okay for a medical company, certainly a medical company like ours, who are dealing with what I would consider very important subsets of specimens for patients and for our clients. It's no longer okay just to do that on a basis where you don't have the very best oversight behind you. And so we decided, as we were growing and as we were taking on more samples, that the best decision that we could make for the company was to introduce specialists in their areas. So we thought, well, we're a medical company, so we need to have some medical oversight, and we went to look for the best fit for a consultant histopathologist that we could find, and we managed to do that. We would share our vision with that person, and their vision, I think, was aligned with ours, and so we onboarded that person to give us that clinical governance or clinical oversight. And then we also looked at, well, when we're talking about histopathology, it's broken into two sections, as we said, and one is consultant driven from a reports perspective. The other is technical and scientific. So we felt we needed to have that scientific or that technical experience, and so we reached out to some key people, scientific people in the industry, to support us with that. And then finally, I think everybody understands this, particularly from a laboratory perspective, which is that, quality and quality management systems are really important. So we looked to the market to find a quality a consultant in quality management and quality management systems, specifically with ISO 15189, 17025 background, and we managed to do that. And then when you form a board like that, what you're trying to do is you're trying to get a really high level of key people in each area, and then obviously we need somebody from the company to sit on that board as well. So I'll sit on that board alongside our three other advisors, or our board of directors, if you want to call them that, and we will sit slightly outside of the company, in a sense that we want to be able to make informed, unbiased, correct clinical, scientific and quality decisions that are better for the company, and thus better for our customers, which ultimately means that we're making better choices for the patient. And I think sometimes in business, it's all too easy just to focus on the business, on the day-to-day on the business. But to introduce a governance board, to introduce a subset of experienced individuals to sit slightly outside of that framework, to be able to hover above it and look at the operations of that business, and to try and make better decisions for that business, is a really important thing. And I think that's what formed our decision on saying we need to go to market to do this, because it's the right thing to do. It's going to make our company better. It's going to make our company safer, of course, but also it's going to be better for the customer. And we sometimes talk about the customer as being like the hospital, or the hospital laboratory, or the clinic laboratory. And yes, they are the customer, but ultimately they're serving another customer, which is the patient. And so patient safety and getting really, really good results back in a timely fashion is the most important thing that we do. And we want to make sure that we do that in a concise and safe way. So that's why we decided to do that, and we very much look forward to actually really developing the business through the vision that our new board are going to set for the company.
Looking ahead, what trends do you see shaping the future of pathology services, and how is HTS Labs positioning itself to lead in that future?
I think the private pathology market has changed, or is continuing to change. It's changed a great deal, even in the 15 or 20 years that I've been working specifically in it. It's changed a great deal. And I'll give you some examples of that. If you look back 20 or 30 years ago when private pathology laboratories started to set up here in Ireland, it was fairly routine work that they were doing, and they kind of struggled. There's some stories of some of the first private labs set up here really struggled in the beginning stages because that referral mechanism wasn't as strong as it is now. And even up to maybe 10 or 15 years ago, there was always a feeling, I think, in that environment that particularly public hospital laboratories, maybe didn't feel that they needed to utilise private labs. That it might have been a slight bit of a disconnect there. But particularly over the last 15 years or so, there's much more of an understanding now between public and private labs in terms of an outsourced service working with public or private hospital labs. There's much more of an understanding now that there's a need for both to work in unison, and that no lab in Ireland, public or private, belonging to a hospital who has patients coming through its door can do everything. They just simply can't do everything. And we have also met this new, if you want to call it, perfect storm of, huge lack of resources, inability for hospitals and health services to fund bringing in new staff and resources. There's a real requirement for hospitals to add new services to their repertoire of what they offer. That creates more tests and so it's becoming very difficult actually for hospital labs to keep up with that momentum. So I think that public-private partnership, if you want to call it that, the view on that has changed. I've seen that shift in the last number of years, and so there's much more willingness now for particularly the customers that we would have and to utilise the resources that are available to them in the private sector, and so that's a good thing. I think yes, it's good for our business, of course, but it's good for the hospitals that need to utilise it. It means that they can take a little bit of pressure off themselves by outsourcing some of the work that is putting that pressure on them in the first place. And so that there's a mindset shift for sure that I've seen over the last number of years. So that's one of the biggest elements for me. But also now there's what wasn't as prevalent, certainly not 30 years ago, and what wouldn't have been as prevalent even 20 years ago, is the drive for sending work out through, say, the tender process, and that's become much more streamlined now and much better. And then obviously this drive for technology, we're moving what would have been seen, particularly in laboratory space, highly technical in one instance, because you've got these wonderful machines that in a lot of instances you have a lot of these machines that are fantastic at getting you results. But when we spoke a little bit earlier on about the IT piece and technology, that was lacking a little bit. And now we're seeing this drive now to use cutting edge technology, cutting edge IT technology to integrate all of these systems to make the lab process work better. And once those IT technologies are in place, they can then be used with your private providers to further streamline that process of referring out tests and moving tests around the country and around the world. So they're just some of the changes that I've seen in my time. That there's much more of an openness to work in partnership with, public-private partnership piece to try and fulfill gaps, if you want to call it that, that may occur within the pathology space. So and I think that trend is really starting to grow to the point where I think certainly I feel it, or certainly in the conversations I'm having around the country with our own customers, is that there's a real feeling of partnership there now, and a real feeling of there's some use that can be gained from using a private partner to help support in your time of need. You won't always need it, but when you do, you've got that help on your doorstep.
Quality assurance is critical in your field. How does your focus on quality assurance impact patient outcomes and client trust?
Yeah, kind of. This is what, like, I've spent guts of 20 years, as I said, in this industry, and I've had my fair share of arguments with quality departments and quality people over that period of time, and I've made no secret of the fact I've had arguments with them, not because I didn't believe in that we needed quality to be at the forefront, but I've always worked in that commercial sphere, and we've needed to try and get things done to allow our customers to be able to use our service. And sometimes quality would slow that down or change a perspective on that or change the context of that in some way. So I've had a checkered past when it comes to QA, but I have an absolute acute appreciation for the fact that we need to have quality controls, quality management systems. We need to have all of our SOPs. Every company that we work with needs to have all of their quality management systems, their SOPs. We need to have those checks and balances in place. Otherwise, we run the risk of doing something inconsistent or dangerous. And as I've always said to people, we're not selling pens and pencils here. We're selling a really important analytical service for patients who, in a lot of instances, could be very, very sick. So we absolutely need to put quality to the forefront. As much as that pains me to say that, I absolutely understand that. And so we've pushed hard here to get our operations up to speed, up to spec with quality standards. So we operate a full quality management system here. We've got quality consultants. We've got in-house quality people. Because we don't own or operate a laboratory, we cannot run for ISO 15189 accreditation because we don't operate a lab. But that doesn't mean we don't want to operate to that standard. So then we set ourselves some other goals, and we moved to become ISO certified. So we've just gone through that process for a dual certification for ISO 27001 and 9001. And why did we do that? Well, we done it because, as we go back to this IT piece, it's really important. We've got patient data passing through our IT system. We've got to make sure that our security systems within that aren't breached and are working at the highest levels and the highest standards that we can within our industry. So hence the reason why we went for 27001. And 9001 is more incorporating your quality management systems and to make sure that we've got checks and balances in place, etc. And so we decided we'd go and do that again. It was painful. It was difficult. It was long. You know this because you were in this, right? So you know this wasn't easy, but it was vitally important that we done it. And I think we've come out the other end of it, and I think we're on track now to have our dual certification very shortly, which is phenomenal news. But not just phenomenal news, but it's brilliant even internally here to see that all of the hard work that everybody in the company, from our drivers right the way through to yourself in marketing and operations and from the management team right the way through, that we've achieved something that shows that our company is without a shadow of a doubt at the top of the totem pole for quality assurance. So yeah, I think the whole idea and the whole structure of the company now revolves around this quality aspect. Again, it pains me to say it because I've spent so many years fighting and arguing with our quality managers, etc., over different things that I want to try and do and incorporate. But we see it as the cornerstone. And then the governance piece that we talked about, this quality and governance board that we wanted, that structure of trying to set that up, was really important as well, because that kind of hones into that. So it's just checks and balances everywhere we go to make sure that what we do is safe, really secure, really consistent all the time.
While HTS doesn't currently have a lab, do you think that would change in the future?
I'll rephrase that a bit for you, right? So we don't currently operate a lab. I mean, we have lab partners, and ultimately that's very much the same thing in an roundabout way. But I know where you're going with the question, right? And it's one that we, from a management perspective, myself, Steve and Jihad particularly, have toyed with for certainly the last 2 years. So whilst being able to load balance and be able to send samples out to your network of laboratories is brilliant, right? Because they're expert in what they do, etc. It's brilliant, and we will always continue to do that. But there are some instances where it would be nice to have our own lab in some format. And we've spoken to a number of players in the market about this. We've been approached by a number of people about this. And I guess the seed has been sown in our minds that at some point in the future, we may very well need to do something, right? In terms of having a histo or histopathology type laboratory based here in Ireland. But I'll emphasise that doesn't mean we would not use our partners. We'll always use our partner labs, because we would never, the volume of work we do right now, even if we built the biggest histopathology lab in the country, we still wouldn't get through all the work that we have, because we do a vast amount of work. It's huge volume of cases. But there are some cases, and there are some parts of the histopathology process that we could very well look to do here. So I'd say Anya, watch that space. Nothing's going to happen in the short term, for sure. It's not, because we're busy doing some other things. But I think over the course of the next while, it's something that we would look to maybe explore in more detail. Whether we do it in partnership, whether we do it ourselves, we don't know that yet. But certainly it's food for thought.
Reflecting on your journey with HTS Labs so far, what has been the most rewarding aspect for you personally, and what excites you most about the future?
I think I don't have some super wonderful mesmerizing piece around this. What was the most satisfying? I mean, the most satisfying for me to this point is the growth that we've been able to achieve, and the support we've been able to provide to our customers, and the feedback we're getting from them. To be fair, I mean, I know this sounds a little cliched or whatever, right? I get that, but I don't mean it in that way. I don't mean it, but I mean, on a day-to-day basis, it's phenomenal to think what we started with, and 4 years later, where we are now. I mean, the vast volume of work that we deal with, the vast array of customers that we have and we're onboarding. That to me, from someone who's worked for private pathology companies for so many years and doing it for those companies, to be able to do it for yourself is really, that I have to say that's super rewarding. And what I look forward to in the future is continuing, obviously, to build our business, but continue to build our team and the company, continue to bring in great people like yourself and like Marie, and I'm working with people that are passionate about what they do, they're passionate about what they add to the healthcare market. I mean, we've got to the size and now and we're handling so many patient cases, etc., that we actually are making an impact, and which is brilliant to know, and a positive impact. And so I do look forward to that, and I look forward to working with new people in the future. I look forward to the business growing in different directions. It's exciting. It's exciting times. And yeah, I think HTS. We're going from strength to strength, and I really do look forward to seeing where it goes to over the course of the next number of years.